Welcome for those of you who are joining live to this webinar. And for those of you who can't join live, you might be watching this in the replay a little bit later as this session is being recorded. So I'm going to start now so that we can move through these slides. And as always, we'll have some Q&A time at the very end of our presentation. So this month is November. Our wellness webinar topic is preventing and managing diabetes. And I'm going to share with you here what I hope some of your takeaways are. You're going to hopefully learn about what World Diabetes Day is, and we'll walk through what the difference is between the different types of diabetes. And also I'll share with you, of course, because that's a whole goal of wellness webinars, of what kind of food and lifestyle strategies would be best used helping you either manage or reduce the risk of diabetes. Our housekeeping, as always, is that, as I'm sure you've heard as you're walking or entering into this webinar, that our session is recorded, and that's obviously in case you're running late or in case you are unable to make this live, then you'll be able to watch the recording later. But you can also use or always use the chat box at any time. I am by myself right now, so I don't have a moderator watching the chat, but I'll stop through every few slides just to see if anybody's chiming in. And as always, we'll carve out a little bit of time at the end of the official presentation in case anybody does want to raise their hand, unmute themselves, or type into the chat any specific questions, whether it's related to this topic or anything else that might be on your mind. I always say, while I am a registered dietitian, I am not your registered dietitian. So please make sure that you receive these webinars as general information and education. I really like to empower people to learn a little bit more about things that they might not get when they are diagnosed with something. So just collect this as info and be sure to reach out to your own personal healthcare professionals before you start any new regimen or stop any medicine program or anything like that that is related to your own personal health. Be sure to get clearance as well if you are engaging in physical activity to reduce your risk of injuries. And at the end of these webinars, probably within 5 to 7 days or so, I usually send out a blast email just to get your feedback. Thank you for coming, and then get your feedback with a survey link. Please make sure that you fill those out. It really does help us, especially since I think I've been doing these free webinars for many years now. And not that I'm running out of topics to discuss ever, but it is something that I enjoy getting feedback as far as how the information is received, or if there are certain topics that you'd like me to go a little bit deeper on, or anything that we might not have covered before. All of this stuff is eventually uploaded within about a month or so after the official webinar. All of these recordings are eventually uploaded to the Dish with Dina YouTube channel. So you can feel free to jump on there and check out all of the wellness webinars in the playlist if you've ever missed anything, or you're looking for other topics that we might have covered before that you were unable to attend. All right, so that's me. Let me introduce myself to all of you who may or may not know me. My name is Dina D'Alessandro with a Master of Science in Nutrition. I am also a registered dietitian nutritionist. Those terms are kind of used together or interchangeably. And I am also coming to you live from the campus at which I work. I am an adjunct lecturer of undergraduate and graduate nutrition studies here in the Bronx through the City University of New York Lehman College campus. And I'm in my nutrition office at the Student Health Center, where I'm also the campus dietitian. So once a week through the fall and the spring semesters, I meet with a variety of different students in our college community, and I help them with navigating their helpful habits and managing any chronic conditions that they might be diagnosed with. I'm also the founder of I'll keep saying this because I'm very excited about it, the newly official registered trademarked Dish with Dina brand. It's basically just a wellness platform stemming out of my website, and through there you'll have blog posts and things like this that I do so that people can find information online that is valid and legit to help you go from confused to confident if you're unsure about how to manage a condition or reduce your risk of getting one. So all of these things, yes, there are ways to work with me in my private practice where I take insurance or you can pay out of pocket, but there's also tons of things that you can find online because I really want to make sure that you are getting access to as best as possible and as often as possible quality information. I'll share with you here too, specifically because we're talking about diabetes. So, one of my first ever jobs as a registered dietitian, that was about 8 years ago now at this point, was in a high risk OBGYN office, obstetrician gynecologist office in Midtown Manhattan. And the majority of my patients there were pregnant people who had been diagnosed with gestational diabetes. So I'll explain that in the coming slides of what that means. But the point is that I really didn't learn a ton about that particular disease state and that population in many of my textbooks. I was really kind of thrown into the real world cases when I arrived on site, and it did not stop me from diving in and learning about what I could do to be of service to that particular group of people and consulting every resource possible, both physical colleagues who would help mentor me and also information that's available through some of my membership groups and educational materials that I have on hand. During those 4 years when I was at that office, I was also trained twice by the Centers for Disease Control and Prevention, the CDC, as part of its Prevent Type 2 National Diabetes Prevention Program. So every week I would work with a local community health center for an entire year, and we would meet either virtually or in person with about maybe 12 to 20 or so patients or residents of the community, where we would walk through the curriculum of the CDC that focused on incorporating understanding about the disease state itself, whether people were currently diagnosed with prediabetes or at risk for potentially getting pre or type 2 diabetes, and then helping them reduce their risk of either getting it or having it progress through lifestyle habits and changes and modifications. So suffice that to say, in the 8 years of me being a dietitian, I have probably worked with at this point thousands, I can't even wrap my head around that, thousands of people that are managing some form or another of diabetes or have been told that they're at risk for it. With that said, I don't think I can ever really call myself an expert in this, much like an expert in any condition. Granted, I have the credential as a dietitian and I know a lot more than other people might, but there are so many complex and challenging factors that are individual that I have to take into consideration when I'm working with these people. And so, yes, it always kind of bums me out that, information about food and nutrition and diseases can be found online. You could easily search something online to find recommendations and guidance to help you understand how to manage your condition. But when you work with a dietitian, this means that I and my colleagues as well, we customize our approaches in order to determine the best treatment for the individual. Because as I said, there's a lot of different factors, and we'll talk about some of those as well. If you're looking to work with somebody who is what's called a certified diabetes care and education specialist, that is a separate credential in addition to being a dietitian. I think nurses can also get that as well, if I'm not mistaken. So there is an extension of being kind of like a subspecialist in the certified diabetes care that also requires about 1,000 hours of having in-person or counseling experience. You also have to know about the different kinds of medications, but generally speaking, dietitians can help you with managing that condition. Also, here are some other things that I am very fortunate and have been involved with that help, again, just give me a little bit more credence and legitimacy in what I do by being featured in some things like research articles and other things across the internet world, and presenting things that I love doing, being a speaker at different events and so on. So if you've never worked with me before, this is our introduction. So again, welcome so much for being here. Today, at the time of this webinar, at the time of this recording, is in fact November 14, and it is World Diabetes Day. So we have about 38 million Americans, unfortunately, who are currently diagnosed with diabetes. And globally speaking, there's probably close to almost 800 million that are projected by the year 2045. So it does make sense that we do things like this to draw awareness and create some public health efforts in order to help, again, educate the population and help prevent or manage the condition. The numbers that are associated with these cases also help with providing more resources available so that we can hopefully at one point find a cure. So I like to just point this out because sometimes people will argue with me, but I think it's very important to understand and recognize the true legitimate language that we use around this condition. There is no cure currently for diabetes, but it can be reversed, or sometimes it's called go into remission to a point where maybe medication is no longer needed, depending again on what you're currently managing or currently dealing with. And I will just clarify this. We're talking specifically about prediabetes and diabetes type 2. Talk a little bit more about the other types of diabetes that are kind of more lifelong or have different risk factors involved in them, ways to manage it. So when we're talking about, again, implementing quote unquote healthy habits, there's a variety of different things through that. But in order to help reduce the risk of this even happening, or reduce the risk of it progressing, we'll share with you today some of those things like diet, physical activity, sleep, stress management, et cetera, et cetera. We are also in November, which is technically Diabetes Awareness Month. So again, this is a campaign to raise awareness about it. And you might see things like community engagement activities or things like this, or fundraising, et cetera. All right, so let's move into what exactly are we talking about when we say diabetes. We are talking about, if you look over to the right-hand side of the screen, this is a physical image of our body, kind of that thoracic region that exists within our chest and our abdomen. And we have a liver, that very large piece of that very large organ that is shown there with that tiny little orangey thing underneath it, which is the pancreas. The pancreas is in charge of making and pushing out insulin, which is a hormone, into our system. So I'll share a little bit more about what that is in relationship to some of the types that you see here. So generally speaking, diabetes is a chronic condition. Chronic meaning consistent, right? Acute usually means there's a finite situation, but in chronic conditions that could be lifelong or long-term, where a person's blood glucose, it's also known as blood sugar, their levels are consistently elevated. So they're spiking and not necessarily coming down in a way that we want them to stabilize blood sugars. Glucose, you hear me talking about this too, that is the sugar molecule. The sugar molecule that is found in carbohydrate foods. And we'll talk a little bit about what carbohydrate foods are as well in the slides to come, which is a crucial form of energy for us to use in the body. Then we have insulin. Insulin, as I just mentioned, is the hormone that is produced by the pancreas there, which helps regulate the absorption of glucose into the cell. So kind of like drives the glucose off into the direction in which it needs to go, so that it's not circulating in the blood system and elevating or spiking that. So what happens is, if you have poorly controlled or unmanaged diabetes, these can lead to a bunch of different complications, unfortunately, like amputations, because we're talking about the vascular system where the blood goes to, and the extremities of your body are affected very, very greatly. And also nearly all systems of the body are going to potentially get affected if there are complications like that. So we're talking about the heart, the eyes, the kidneys, the skin, etc. Major complications can also result in death. So this is why it's important for us to educate and help manage this before it does reach that level. So DM, diabetes mellitus, is the technical term for diabetes. We sometimes will just see it written as D or DM. We start with type 1. So type 1 is not something that can be cured or even technically not put in reversal or remission, because it is a lifelong autoimmune condition. In this case, the person's pancreas makes no insulin whatsoever, or very, very little. It's very, very little. And it's typically diagnosed in childhood. So back in about maybe 20 years ago or so, I think we used to call it juvenile diabetes, but really people can get diagnosed with this even later in life. I've known people who were 3 years old, 9 years old, 20 years old, because it can be related where something is affecting the pancreas. So there could be a virus or some sort of environmental factor that affects the body system, in which case then it kind of destroys the pancreas's ability to make insulin. So insulin management in the case of somebody who is diagnosed with type 1 diabetes, they are going to be on lifelong insulin, something that is going to take the place that their body would naturally make. And we'll talk a little bit about that too in the treatments. Pre-diabetes and type 2 is kind of like the crux of what we're going to be talking about today. And just like I said before, when you do see information about diabetes or diabetes awareness, we're really talking about pre-diabetes and type 2. So these are often diagnosed by blood tests, which I'll share with you in a second, that determine if somebody is on the border of that condition, or if in fact they are officially diagnosed with type 2 diabetes. So the emphasis here, depending on the treatment, and there could be combinations of things too, is really to reverse that condition or reduce the risk of it progressing to something else. In the case of prediabetes, not to go to type 2. In the case of type 2, to hold that in remission and not have any complications happen in the future. Gestational diabetes is specific to the pregnant population. I mentioned I worked in high-risk OBGYN, so that was the majority of the people that I was working with. It does occur during pregnancy. It can potentially cause risks for both the pregnant person and the child. So we make sure that we monitor the pregnant person during those. I think they would be diagnosed around weeks 24 to 28 of the pregnancy. So sometimes they won't come see me until maybe week 30, and then they have about, 10 weeks or so before they deliver. So we really try to make sure we're looking at that quite critically in both the sonograms and the pregnant person's lifestyle as well, to try to see how we can adjust or manage that. So being being pregnant puts that person at risk because we have two blood systems. And again, I'll talk a little bit more about risk factors coming up, but in that case, the body's a little taxed. So if they can't produce enough insulin to meet the increased needs of the overall pregnancy, then that can also lead to high blood sugars as well. So managing gestational diabetes is important for two people in that case, the pregnant person and the child. Lastly, type 3, not officially a term just yet, I don't think, but in some of the clinical conferences and other webinars and seminars that I've been attending, I keep hearing this come up that it's possible we're going to start seeing cognitive decline and specifically Alzheimer's disease be linked to insulin resistance or insulin sensitivity. So some research is appearing right now where it feels like this is based a little bit more on theories and not necessarily hard evidence, but we might start seeing some updates from that soon. So just something to keep an eye out or be aware of if you are noticing the language kind of change around that, or you might, if you're, as a lot of you are that are in the health sciences, as I am, that might be something just to keep an eye out if that's the area in which you are focusing. All right, let's talk about risk factors. So I mentioned before with type 1, the risk factor could be genetic, it could be an autoimmune condition, it could be related to a virus that destroys the pancreas, in which case not much you can do about it. So the goal is just to stay on lifelong insulin to support what is missing from the human body. In things like gestational diabetes, just being pregnant can put you at risk for getting well, it's not technically pre or type 2, but technically gestational in that sense. And gestational diabetes can in itself be a risk factor for leading to things like prediabetes or type 2. Once the baby is born, it's not like, woohoo, we're in the clear. The pregnant person does have to come back, and I think about 3 months postpartum to do another round of blood tests to make sure that they are in the clear. And like I said before, there's also a slight risk also of the baby being diagnosed. So we want to make sure we're monitoring the baby as well. I just want to stop for a second because the title of this webinar is Preventing and Managing Diabetes. Can we really guarantee that anything can be prevented? I would probably argue no. I can't really guarantee that something could be prevented 100%. But I think knowing the risk factors, and again, learning about things, educating yourself, understanding the questions to ask might help you kind of feel a little bit more confident or have some control with reducing our odds of getting a disease to begin with. So in here, as you can see on screen, we have things like smoking, getting older in age always puts us at risk for a bunch of fun things anyway to begin with. Cardiovascular disease, we talked about systemic issues too. So not only would uncontrolled diabetes potentially cause other things in our body to occur, but sometimes other things that are occurring already in our body. If we're managing multiple conditions to begin with, we're kind of taxing the system, and that might also put a strain in the way that our blood sugar is being managed. We have something also called insulin resistance or insulin sensitivity, and people who are diagnosed with something known as PCOS, polycystic ovary syndrome, are also in that family there. So their body is kind of acting as if there's an issue with stabilizing and managing their blood sugar. So we have to make sure that they are being monitored as well. And that can also be related to some reproductive issues down the line too. So again, you can see a wide variety of things here. I mean, what are things within our control? argue to say. Obviously, we can't control our aging. It's going to happen. You can't control your race or ethnicity, but it's possible if you have the means to do so and the access to do so. There are some other things that we can talk about today to help you take control over stuff. I will also point out, because you know how I am with the discussions around weight and weight stigma. Yes, there are research studies that do correlate indirect measurements of abdominal fat, again, where we see excess body fat appear in the human body. We don't always just say that somebody in a larger body is naturally going to be unhealthy and somebody in a smaller body is automatically healthy, but just taking into account that depending on what other factors you have going on, that some of that body fat distribution will also put you at risk too. So we'll go a little bit more into detail in the slides to come. Some of the warning signs, and by the way, this could be both in type 2 and in prediabetes slash type 1 and prediabetes and type 2 diabetes. In the case of gestational diabetes, people will automatically be given a test around, like I said, week 24 to 28, and I'll share with you in a second. But it's possible because of the pregnancy, there might be some things that you're not entirely paying attention to because there's a lot of things going on during pregnancy as far as signs and symptoms. But if you've been living your life not really having any issues, and all of a sudden you're finding yourself possibly faced with some of these things, like going to the bathroom quite often, urinating quite frequently, feeling very thirsty, dry mouth, extreme fatigue. We talked earlier about how blood sugar levels, because of the vascular system in our body, so some of those extremities might be affected. So things that you might feel tingling or numbness in your feet, your legs, your hands, or blurry vision because your eyes are also very vascular. There's a great amount of blood in your eyes as well. So all of these things taken into account, some things you might not even notice, or they might be so mild that you're not really paying attention to. But if you feel like you know your body well enough, hopefully, right? If you feel like something's wrong, maybe go get checked out, and also obviously keep up with your physical exams, your annual wellness exams, because the information that I'm about to share with you of how diabetes is diagnosed is already usually in your usual blood panel, so you'll be able to catch that before it becomes an issue. So let's talk a little bit here about how diabetes is diagnosed. As I mentioned with type 1 and pre-diabetes slash type 2 diabetes, we have some blood tests that are taken. So we have what's known as the hemoglobin A1C. And you can see the units of measurements here from bottom to top of what the range is. If you are below 5.7%, then you're in the clear. If you are in that orange area, then you are on the border and they might diagnose you with pre-diabetes. And then 6.5 or above would be where you are going to be diagnosed with type 2. In type 1, like I said, that's an autoimmune condition, so there's no real way to treat that in the same lifestyle approaches things, even though those are very obviously very beneficial, but we'll talk about how the type 1 diabetes diagnosis gets managed. So if you're looking at your blood screening panel, the labs that you get back from your doctor, if you are at the pre or the diabetes section here, odds are you'll probably be told to go follow. Hopefully you'll get told. You can also request, or sometimes insurance companies don't need you to get a referral. Request to work with a dietitian to help with managing some of the health habits that are related to this condition. And then you might be told to come back in about 3 months to go get your blood checked again, because your blood does kind of regenerate. Old blood cells leave, new blood cells are formed. And so the doctor can work with you to see if they're noticing improvements in that diagnosis. You also have what's known as the fasting blood sugar test. Usually that is going to be done with what's called a finger stick. So you might have seen, and I think I have some pictures on here too coming up, where you might have seen somebody actually, they have to use a lancet to prick their finger, and then they put the blood droplet on a strip, and they stick that strip into a glucose meter, and that meter then reads out, in this case, it's a different unit of measurement. So it's not a percentage of the blood being drawn from your body in a vial, but instead it's that tiny little drop that's being placed in that meter, and that reads out Again, here, if you're 99 or below, you should be in the clear, 100 to 125. And again, I just want to clarify, this isn't like a hard, fast rule here. Some people have spikes and drops just normally speaking, and they might not even know what's going on, or they might have what's known as impaired fasting glucose, meaning that their blood sugar just naturally spikes in the morning time and then kind of levels off. But again, the more data you collect, the better it usually is. And on the right-hand side there, also done with what's known as a glucose tolerance test. This is just for the gestational diabetes usually, and it's done through a very, very, I call it a gloopy gloppy sugary drink that is administered to the pregnant person around week 24 to 28 when they are in the second half of their pregnancy, where things are kind of breaking down and they can really get a good handle as to what the issue is there with their blood sugars. And so again, here, the discussion with your doctor and yourself. We'll talk a little bit about treatments. You may have to go on medicine, you may not have to. It might be cautionary, maybe it's short term, with the caveat of type 1 will always be on meds. So let's talk a little bit about that, right? So how is it treated? If you are dealing with diabetes in whatever shape or form, we have a variety of different ways that we're going to be able to help you control that or manage it. On the left-hand side, we have medicine, and I'll go over some things in a second to give you a better understanding of what that means. Again, it's always good to understand what's going on so that you feel like you're an educated patient when you show up to your doctor's office. And because blood glucose levels are so closely tied to carbohydrate intake. We'll talk a little bit too about food and nutrition. So your healthcare provider might prescribe a variety of these things, one form or another. And they might also ask you, which I always think is a good thing to do. If you're going to be put on a particular regimen, sometimes I would encourage somebody to take finger sticks, but people could also argue it might become a little bit stressful to do so. So again, talking with your healthcare provider, if that is what it entails, if they're having you come back, say in 3 months to check your blood again, they might not make you do the finger sticks on this sense. So again, keeping control is critical, but there might be some flexibility depending on your particular condition. The American Diabetes Association does recommend that healthcare providers, okay, so it says healthcare providers, but we know that I'm always going to advocate for the value of a dietitian being on your healthcare team, your interdisciplinary team, that we create a personal diet for each patient because everybody, as I said before, is very individualized. So here's where I get a little bit on my soapbox that if your doctor is just diagnosing with something, barely explaining anything to you and telling you to stop eating rice, I'm going to say, please come hunt me down and let's have a conversation with your doctor about that, because we don't want to scare you about what you can and cannot eat. There's a lot more flexibility about how to manage diabetes, and we're going to go over that in a second. But working with a dietitian, you'll be able to really manage and create that flexibility for you. On the right-hand side, because everything is related, right? You're a human person and all things are connected in some way. We talked a little bit before about stress management and sleep and physical activity and tobacco cessation, etc. So all of those things combined. I always say that it's a flippin' full-time job just to keep this whole thing going. So again, working with a dietitian or trying to prioritize certain things that may have an effect on your glucose levels is really where we're going to focus on so that we continue to reduce the risk of that condition getting worse or even having it diagnosed to begin with. All right, I purposely cropped this picture in case people don't like looking at needles, so I hope that that's okay for anyone who might be watching this. So we're going to talk first about the medicine discussion. I'm not going to go too far into detail because there's like a bajillion different forms of drugs out there currently, but in the case of type 2 diabetes, not necessarily pre-diabetes, because I don't think anybody's going to put you on things just yet, but I could be wrong about that. Again, it's person by person conversation. But sometimes we also see when people are diagnosed with polycystic ovary syndrome, because that is related to that insulin sensitivity condition. So you might be put on non-insulin medications. The reason why they're non-insulin is because your body is making insulin. It's just not getting to where it needs to go, right? So we said this term of insulin sensitivity or insulin resistance. So what happens with these non-insulin medications, which by the way could be oral, they could be pills that you're taking, or you could be told to inject yourself with that. So you might be taught how to administer the injection because obviously you want to make sure that that's safe and not you're not like creating an infection in the area that you're injecting yourself with. So some of the options that I have in front of me here is you might be familiar with metformin. That's a very big one. That's usually a go-to one. We also have things like GLP-1. Some of you might also know that as Ozempic, which is making the rounds these days. We also have something called an SGLT2 inhibitor. And then we also have things called sulfonylureas. I think I'm saying that correctly. What those do is they help either decrease the blood glucose levels already. So your glucose is produced in your liver, and so metformin in particular, as an example, is helping lower the blood glucose to begin with. So it's making the muscle tissue more apt to absorb the glucose that's going on there. The other ones also kind of play that role too. So they help lower blood glucose. Some of them, again, this is why sometimes the discussion around weight is a little bit tricky because not everybody in a larger size body may have diabetes, and not everybody with diabetes is in a larger size body. So some of these, like the GLP-1 receptors, the Ozempic one, that sometimes usually will have a body weight decrease as a side effect. So if you're already starting out as a quote unquote normal healthy weight for whatever that is for you, that might not be the way to go because we definitely don't want you decreasing weight or specifically muscle mass, which sometimes goes along with that. The other ones can block that action of having the glucose in the bloodstream being reabsorbed by the kidneys. So in that case, the excess glucose is going to come out through the urine. So it's going to kind of give your body a pathway to excrete that blood glucose. And then the sulfonylureas, I will not be able to say that correctly, I apologize. Those stimulate the beta cells that are in your pancreas. The pancreas, we said before, is the thing that's in charge of making that hormone to increase more insulin to come out. And in that one, we actually have a side effect that does the opposite, where sometimes you'll see weight gain. So again, have conversations with your doctor, know what it is that you are being treated for and what those medicines are going to do. We said earlier too, if you're in remission or you're reversing it, this might not be lifelong. You might be able to reduce the dosage or come off of your meds completely. The only exception here, like I said before, is type 1 diabetes, where you have insulin. Insulin is going to replace because your body is not making it, so it's an artificial form, or sometimes there's more like, human forms available to it or identical forms to it, where in that case there would be insulin injections or what's known as a pump. So some people have an implant already in their body and they use a little thing to kind of adjust how much insulin is coming out of it. And doing frequent checks with that too. So type 1, that's going to be part of just their lifelong way of managing their condition. All right, let's go into the discussion because listen, if I know anything about America is everybody hates carbohydrates and I'm starting to get angry about this. Carbs are important. They're part of your macronutrients. They are the 3 things that we eat in life to help our body move and function. We have carbohydrates, we have proteins, we have fats. So carbs are an essential nutrient that are found in foods like you see in here. You have grains and all the produce things you can think of. Milk, dairy, we're talking cow's milk or animal milk, has a form of carbohydrate in it known as lactose, right? That's a naturally occurring milk sugar. No other animal product is going to have carbs in it. So things like this are great because they're an immediate source of energy. They really help provide the body with what we need to develop the brain and move and all these things. I won't go too far into detail with what I'm about to share. So I'll just say there are 2 categories of carbs. Sort of. There's simple carbs and complex carbs. So one is a little bit what's known as refined, where the bran or the outer shell would be taken out or processed. Those are going to spike your blood sugar a lot quicker. And then we have more complex carbohydrates, which are a little bit lower and slower when they start digesting. So let's talk about, I have 4 different things that could be used individually or in combination. So maybe if you're already managing this condition, you're aware of this already. If not, this might be news to you. The first one is carb counting. And I will caveat this by saying sometimes this is a little tricky because you have to either look stuff up like an orange. An orange doesn't come with a label. So you have to look stuff up online, or you have to be given a resource, thing to flip through, or you have to start learning how to read packages. So the way that carb counting works is that you are looking at a serving of carbohydrates is equal to 15 grams of carbs. So it's not the same as looking at the back of a package where it says like 1 cup of beans, right? 1 cup of beans is a serving size of a portion for you to eat. But within that 1 cup of beans, it might be containing 33 grams of carbohydrates. So here is where carb counting can help, because each serving, carb serving, is equivalent to 15 grams of carbs. So if you look at something like a can of beans, as the example I just gave, 33 grams of carbs in a serving size would be 2 carb servings, right? 15 plus 15 plus a little extra. So that would be 33 total grams. So you would have something split out that you can look at as like a meal plan for yourself. Every meal that you're creating for yourself will maybe have a max or a limit of 2 to 3 or 1 to 2 carb servings, with again the extension written out there as an example. So 1 carb serving is 15 grams of carbs, so 15 to 30 grams of carbs, or 30 to 45 grams of carbs, or 45 to 60 grams of carbs in each meal, and then that's it. I don't love this because it puts the focus on carbs, but this is very important if you are doing insulin or you are injecting yourself or creating a dosage, because your body will need to understand how many carbs it's taking in and how you offset that with your medicine management. The next thing for those, I'm laughing because for those of you who did the dietetics program with me or have gone through the health sciences, this was the bane of my existence, and I'm so glad to report that the American Diabetes Association is no longer recommending an exchange list. This was bananas. This one basically was kind of related to the carb counting discussion, where we are looking how food groups are placed together and like how many carbs are existing in those things. But that was a nightmare, so we're just going to pass right over that because we're not using that anymore. The third thing, I actually like this one, and with the fourth one that I'm going to show you in a second, the plate method. So I just gave you the handouts that the American Diabetes Association has available online. But the issue here is that not everybody eats like this. Not everybody puts things on a plate. Like you might have a smoothie, or you might not know what's in something if you're making a soup or a stew or something that contains a lot of different ingredients. But the goal is that you're trying to create meals based around prioritizing your protein and prioritizing your fibrous foods. So your plants, your vegetables, and then the carbohydrate or the grain-based foods or the things that might be a little bit more starchy that could affect your blood sugar level, they go up into that little corner of the plate. Now, RIP, any of us who have staple items and staple traditional recipes that we make with rice or with pasta. But the way that I usually approach this is I tell people, start off with this ratio. And what you can do around that is if you want to go for a second serving of something, then go for the second serving. But try not to have 90% of the ingredients be carb-based if you are trying to manage or reduce your risk of diabetes. Okay, so hopefully that makes sense. And this is kind of a good visual to give you as an example. But you can see also here they have like, samples of what you can plan out there. Another thing too, again, not forcing anybody to weigh and measure every single ingredient, because that can also get quite stressful and some people get a little obsessive over it. But we use our hand. We use our hand to determine what is a serving size of something. So a fist or an open palm, those will be somewhat similar to either a cup or a half of a cup. And again, a little bit of everything on your plate, just to make sure you have a good balance. The goal being to manage and maintain and stabilize your blood sugars. The last one here that I also like is meal timing, especially since I work with people who skip breakfast and go long hours focusing on work and forgetting to get up from their desks or cramming for a midterm exam. So making sure, in this case, we look through the day in the life of you. And what we usually recommend is maybe setting a timer for yourself. And of course, that would also require you having some kind of meal plan available to you, whether you're making things at home ahead of time or keeping some snacks in, as you're grabbing and going things. So we encourage eating a breakfast some people will say within 30 minutes of waking up. I disagree. I try to look at when do you wake up and what's the first thing you're about to do. So as a general rule, a couple things here exist. If you know how many calories are in something, about 100 calories equals about an hour's worth of energy. So if you're going from 7 in the morning to 12 o'clock in the afternoon from one meal to the next, right? Do the math. What is that? That's 5 hours. It's not to say that you have to have a 500 calorie meal the second you wake up, but have a little something to kind of kickstart and get that blood sugar nicely kicked and stabilized there. And then maybe have, whatever that's 200 calories or 150 calories first thing in the morning, or, somewhere around the range of like 90 minutes or so after you wake up. And then every 3 to 4 hours, you're kind of feeding yourself a little something, whether it's a large meal or a snack. And the reason for this is because we don't want spikes and crashes. And we're also combining this discussion with the previous recommendation too, of remembering to focus more on the proteins and the fibrous foods, and then kind of backfilling with your grain foods or things that might end up spiking your sugar. I want to also mention late night snacking. I'm not opposed to people who get hungry at the end of the evening, but if you are going to have a snack, moments before you go to bed, try not to have something that is going to spike your sugar. So eat something that is not necessarily a high carb meal. So maybe have a hard boiled egg or have crackers and cheese or have an apple and nuts, right? We're talking about kind of balancing those out and creating a plan for yourself. All right, other habits, as we're coming towards the end of our webinar here. Let's just take a breath for a sec. I don't see anything in the chat, so I'm not going to stop my discussion, but I'm going to go through the next slide here, which shares with you the other three things. And this, by the way, this isn't just making sure that you are like, hitting on all the habits. These are things that if they are falling off track in some way, can also affect your blood sugar. Something that people don't understand. When I work with people who are doing the finger sticks or who are tracking their blood sugar over the course of the day through either finger sticks or the glucose monitor that is stuck onto their arms, or they have some sort of monitoring device like an app, when you see spikes and things like that, even they'll say to me sometimes, I did everything I was supposed to do with my food. I counted my carbs, I adjusted my insulin, but this still went a little wonky. And usually what we find is either they had poor sleep habits, quality and quantity, so not enough sleep, or erratic sleep. They were getting up and couldn't fall back asleep. This happens also with people who are, raising little kids, getting up every 2 hours. So just being mindful that it might not be related to the food. It might be related to hormone fluctuations that are happening because of sleep issues. Stress as well, easier said than done with trying to manage stress, especially if you're not having good sleep and especially if you're not moving around a lot, finding other ways to create stress management. And if you want, this might be a good time too that you can put in the chat. What are things that you do to help manage stress? Is it physical activity and movement? Is it socializing with your friends? Is it prayer or meditation? Is it journaling about things? Is it deep breathing? If you remember, I think was it last month? I think it was October. We did the mindful health and wellness webinar. So you can always go back and check that out. I think that's going to post soon to the YouTube channel if you want to go and check that out, where we gave you some techniques to help manage stress. The important thing is to stop it before it gets that way. So some of the things I tend to say too, in that sense is it internal or external? Is it stuff that is within your control or outside of your control? If it's within your control, figure out ways that you can reduce that stress from even happening, like how you react to things. If it's outside of your control and people are really ticking you off, you might have to have conversations that are uncomfortable but necessary. You might have to set some boundaries with people. Last but not least, we have physical activity. Again, physical activity causes your muscles to use more glucose. So it can decrease, like we were talking before with the medicine management, it can decrease your overall blood glucose levels. So all of these things, yes, I know in the realistic world, what can be done, but if I can help you or you can find ways to prioritize, like put all of these things together in some way, then hopefully that will. Can it prevent things from happening? Maybe not, but can it reduce the risk of things from happening? Maybe so. All right, my friends. So think about where you currently are right now, especially since this is almost the end of the year. The holidays are coming up. I know a lot of you start with the new year, new you type of deal. Don't wait till January 1st to get things going. Try to see where you can kind of take an inventory of some habits that maybe fell off a little bit, where you think you can use some support, where you might need to reach out and learn a little bit more about individualizing your approach, whether it's going to be making sure you're getting medicine, whether it's meeting with a dietitian and your healthcare providers, whether it's tweaking any of your healthful habits. Please start now. And however I can be of help to you, please let me know. All right, I'm going to check the chat and I'll keep this on screen here. Before I check the chat, if you have Q&A, obviously feel free to raise your hand or throw it in the chat, any questions you might have. The next webinar, we're going to step aside a little bit and do some stuff about food. I'm not going to do a food demo, but I'm going to talk about winter root vegetables and maybe give you some ideas about recipes to make now that it's getting in the colder months, at least here in the East Coast. That's going to be on Thursday, December 5th from 12 to 1 p.m. So when I send out the wrap up thank you email for this, you'll also get the link to that webinar if you want to register for it, as well as in my newsletter that goes out in the beginning of the month. Online, I really encourage you, know, like, and trust me, hopefully by now, share. All of this stuff can't happen unless we get people in and we spread the word. So support me in however you can. Either work with me or share the information or go subscribe to my YouTube channel or go listen and follow my podcast. There's so much information online, either on my website or across the social media platforms as at Dish with Dina. All right, let's take a look in here. Thank you, Joe. Yeah, all of those things. I like to take a moment to do any variation of box breathing. So we're talking specifically about stress management. Absolutely. Oh, I appreciate that, Joe. Thanks so much. Of course, Latrice. It's always nice to see you in here. Appreciate you so much. As I said, realistically speaking, it's kind of hard for us to always be managing every single thing. But the more we can take steps towards that, then the future us will be very grateful for that. All right, friends, on that note, it was so lovely to be with you here today. I always appreciate your support and engagement, and I will see you again, hopefully, in our next webinar. Bye, everybody.